this session, as part of our advanced care planning series, is on organ and tissue donations. I am Eileen Doherty, and I'm the director of the Colorado Gerontological Society. And I have pulled all of the information today from the Donor Alliance, which is the designated agency in the state of Colorado to accept tissue and organ donations. There are some other groups in the state or that work in the state that do more sort of whole body donations, but the Donor Alliance is the one that is designated for tissue and organ. So the mission of that organization is basically to save and heal lives through organ, tissue, and tissue donation and transplants. They are the recognized leader in facilitating the donation and recovery of transplantable organs and tissues. So maybe some of you have signed up with other groups. Make sure if you have and you are interested in doing this, that they participate in the National Donor Registry. So organ and tissue donation is basically recovering organs and tissues from a deceased person for the specific purpose to save and heal lives. So as one individual, you can have a pretty significant impact. If you donated all of your organs, you could save 8 lives. And if you donate your tissue, which is different, you could save 75 lives. There are about 500,000 people in the United States who get either organ or tissue donations annually. So that's a lot of people that we can impact with this donation. In Colorado and Wyoming, which is where the Donor Alliance works, we have about 1,500 people on the wait list for organ transplants and about 100,000 in the nation at any point in time. Transplants really offer patients a new chance at a healthy and protective life and allow them to return to their families, friends, and communities. She has passed away, but we have one person who's on our staff whose family member was able to get a transplant. After some 10 years, that transplant failed and she got a second one. And so she was able to not only get 2 transplants, but she was able to work and be a productive member of society. So if you're thinking about doing organ donation, here are some things that you should consider. So how does organ donation affect medical care? It does not in any way, shape, or form. As a matter of fact, they want you, or you should be using aggressive, life-saving care to be a potential organ donor. Now, make sure that you understand organs are things like your liver, your pancreas, your heart, your lungs. Those are organs. Tissue is things like your corneas, your bones, your tendons, stuff like that. If your heart stops during these life-saving efforts, then you cannot be an organ donor. You can still be a tissue donor, but not an organ donor. An organ and tissue donation is considered after the physician has pronounced you dead and the family is consulted and says, yes, this is what we are interested in. And then they check the registry to see if you have signed up. Anyone can donate regardless of your health. So sometimes when I have had this conversation, especially as part of filling out advanced care directives, people have said to me, well, I'm old or my body's not in very good condition. Can I still donate? And the answer is yes. Usually we do not donate organs or tissues for people who die of cancer, except corneas, which is the center of the eye. Organs and tissues are always tested for any type of infectious disease, including things like AIDS or hepatitis or any other infections. So again, we have to be really, really careful as part of this donation process that whatever the donor organ is to the recipient, we do not transfer any type of infection because we run the risk already of the body rejecting the donor organ. So we don't want to have any type of infection interfering with that. If any of you have completed advance directives, such as a medical power of attorney, very frequently you will see on that form, depending on which one you use, whether or not you want to be an organ donor. While that is a valid way to indicate your wishes to be an organ donor, it's important to know that that document may not be available at the time when you would be declared dead or deceased. And so a better way to do it, in addition to making those wishes known on your medical power of attorney, is to actually sign up with the donor registry and get that request in as part of the state system. And we'll have some information later in how to do that. There is a difference between donating organs and tissues versus a whole body donation. So tissue is always the very first thing that is considered because more people are able to do it. Even if your heart stops and your brain is also stopping and you're not getting any blood flow through to the body, you can still donate tissue. In organ donations, that is considered second, and that happens when your heart stops, but your brain, or not, I'm sorry, it stops when your brain is dead. Then you can do organ donation. But your body, then they keep blood flowing through the body once your brain is dead. If you decide to do a whole body donation to like a medical school for science, or there also are some other for-profit entities around the country that also accept donations. Usually when they accept those donations, you as the individual don't get paid, but that company gets paid, and sometimes that's known as selling body parts. If you do a whole body donation after the body is used for whatever medical research that the research institution is working toward, then the body is cremated and the ashes are returned at no cost to the family. Sometimes, though, that process can take 2 to 3 years. And so just be prepared if you decide that you are going to do whole body donations. You can indicate which organs you want to donate. Again, you just put that in the donor registry when you sign up. You can also indicate that the donated tissue has to be used for life-saving or reconstructive purposes. You can indicate that you want it to be distributed to nonprofit organizations, and you can limit that if you want it to be only donated in the United States. So you can make all of those kinds of wishes if you want, known as part of your donation or your sign up with the donor registry. By law, anybody can get your organs. You cannot restrict who gets them. So that is a decision that is made with federal guidelines The Donor Alliance here in Colorado simply contacts the federal group, and they are the ones then that make the decision as to who will get the organs that you donate. If you have been in prison, there is one restriction, and that is that you have to be out for 5 years in order to be an organ or donor or tissue donor. And I don't know the background for that statute. I just know it exists. If you want, you can also do what's called a directed donation. That means that you can indicate who the recipient is, but that indication or that donation and the donation going to a specific individual has to be done at the time of the donation. So say you had a child that was suffering from kidney disease, and you wanted to be able to donate an organ to the child. If you were to be brain dead, you would have to designate that when you sign up for the registry. If you become brain dead and it goes to the Donor Alliance, then the federal registry would, and the federal group would decide who gets the donation. If you want to do a directed donation, it's best to do it by your advance directive within the, again, Donor Alliance, and then also making sure that whoever your next of kin are know that that is what you want to happen. So how does this donation process work? Well, the first thing we'll do is take a look at this little graphic, which I thought was pretty informative. So what we have on the left-hand side in the blue is the organ donation. So we can see it's the heart, lungs, liver, kidneys, intestines, and the pancreas. On the right side, we have tissues, and that is the cornea, your tendons, your heart valves, your veins, your skin, and your bones. All of those can be donated as tissue, and there are different processes for each of those to occur. So let's look briefly at organ donation. So after you are declared legally brain dead and the medical team has gained consent from the family or whoever is making decisions, then you remain on a ventilator for a short period of time due to the fact that you are considered to be clinically deceased. And at that point, the donation process begins. That is when then they contact the Donor Alliance. That's when they contact the national group. That is when they begin to look for a recipient in the national database. That is when they begin then to put into place all of the stuff around the donor team that transports the organs. That is the helicopters or the airplanes, all of that kind of thing. Brain death is different than being in a coma. So if you are in a coma, there's still blood going to your brain and it can work. When you are brain dead, all of the functions within your brain have stopped permanently, and you are only on life support for the specific purpose of maintaining the organs, not for the purpose of restarting your brain. Tissue donation works a little bit differently. It can occur if the heart stops or if you're brain dead. It does have to happen within 24 hours of death, and it can be processed and or stored for a period of time. Most everyone could be a tissue donator. And here's what we use tissues for. So corneas are used to restore sight. Tendons are used to rebuild joints. Heart valves are used to fix your heart or heart defects. Veins are used to establish circulation. Skin is used to heal burns. Bones are used to prevent the need for amputation. And birth tissue is often used in reconstructive procedures to promote healing, as well as to treat burns and other wounds. So if they have to do like a skin graft and they have to look at using grafting skin that's not your own, they might use birth tissue. So all of these are ways that you as a tissue donor can save lives. And as I said earlier, corneas are always welcome. Additionally, I have heard lots of times that people, they want bones, especially for people who may be facing an amputation. So the donation process, basically how that works is that there is a referral from the hospital where the individual has facing imminent death, brain death at that point. Usually or oftentimes it's a car accident or some other type of tragic accident, as opposed to I'm in the hospital and I'm sick. The hospital then the physician declares that you are brain dead. The donor registry is activated, if you will, to then find a suitable donor. There's discussions with the family. Then we have donor management, which is getting the donations to from the hospital where the person is, getting the person who is going to be the recipient into the hospital, getting them prepped, etc. And then there is the recovery for the person receiving the donation, and obviously then funeral arrangements for the person who passes away. Funeral arrangements, usually you go ahead with a usual funeral. If you are looking at a traditional burial, you can do an open casket, even if all of the organs have been what they call harvested, meaning that they've taken all 8 organs, as well as some of the other tissue donation. Usually the recovery process, meaning taking out the organs and the donation and the tissue, takes between 24 to 36 hours. And then after that point in time, you can proceed with whatever funeral arrangements that you were planning to do, whether it's an open casket or a cremation. The cost of making a donation, there is no cost to you to donate your organs or your tissues. The Donor Alliance assumes all of the costs associated with recovering the organs and processing them once death has been declared. So they make arrangements for the transport, they make arrangements for the staff who transport the organs, they do all the paperwork, all of that kind of thing. The Donor Alliance then is reimbursed through the transplant centers for the cost that they incur getting the donor organ to them. And then after the transplant is complete, the transplant center bills public and private insurance, such as Medicare, Medicaid, your private insurance, and then they reimburse the Donor Alliance for any costs that they have incurred. The hospital costs, though, are yours before the donation of organs or tissues starts. So at the point at which you have decided that you are going to donate your loved one's organs or their tissues, then at that point, the hospital no longer charges you. They charge the transplant centers and the Donor Alliance. We do run the risk that there is or can be a rejection of organs or tissue. Everybody's immune system is different, but one of the things that they have worked on a lot over the last few years is a lot of new medications. So these medications actually really reduce the risk of rejection. So rejection rates now, according to the Donor Alliance, are as low as 10 to 15% of patients, and 1 year survival in organ transplants has climbed up to about 95%, which is a pretty high success rate. There's also the option to do what they call living donations. This means that I, as an individual, could donate 1 kidney. I can live just fine with 1. I don't necessarily need 2. I could donate part of my liver, a lung, intestine, or pancreas to another person. Those will regenerate, the liver, the lung, the intestine, and the pancreas. Things that have to be considered if you're doing live or living donations is what is your blood type? What is your overall health? They obviously have to do full medical evaluations with labs and making sure that this is what you want. And then the medical team where you are working with at the transplant center has to make the decision as to whether or not they could accept the donation, and if that is something that makes sense for everyone involved. Sometimes we hear of some fraud, or we hear of people who might be very vulnerable being told and offered some obscene amount of money if they donate a kidney or other organs. So again, we want to make sure that that doesn't happen. And if we're in reputable transplant centers, we know that that won't happen. So as we said earlier, if you as an individual donated because you were brain dead, all 8 of your organs, you would save 8 lives, and you can help or heal up to 75 lives if you donate tissue. How do you sign up to be an organ, an eye, or a tissue donor? And it's actually relatively easy. If you get a new driver's license or a state ID, you can simply indicate that on your driver's license. And that then gets put into the Donor Alliance's registry for the state. Or you can go to the website called donatelifecolorado.org, and you can sign up there and fill out the form. Because the Donor Alliance also works in Wyoming, if there are people that you know in Wyoming, they can sign up for the Wyoming Register. The registry then, anybody can sign up and your name goes on the registry. You can take your name off. It's a relatively simple process if for some reason or other you change your mind. You can send a letter indicating your full name, date of birth, driver's license number, and an email and a signature. And then you get a letter or an email saying that your name has been removed. The one thing is that the Donor Alliance may reach back out to your family at the time of death to see if you do want to be a donor or if you have reconsidered, and your family can make the decision that you could be a donor if they wish. If you want to make a referral, here is a telephone number if somebody else is interested in doing that. And that brings my comments on to for organ and tissue donation to an end at this moment. Just to briefly review, the Society offers a number of different programs, which I'm sure most of you are very familiar with. If any of you have any questions or would like to take advantage of any of those services, feel free to give us a call. I would just mention that we are currently planning the Salute to Seniors on August the 24th, be at the Greek Event Center, which is near the Greek Assumption Cathedral off of Colorado Boulevard in Alameda. Well, we welcome you to join us in any of our other training or education programs as well. Thank you for joining us today, and I look forward to sharing more information.